So coming to injuries is exactly what you said. A lot of people have suffered injuries, especially when working out, made before either muscle building or for cutting down or for sports specific training that they do. But then what happens is once they get injured,
They give up.
they either they give up or they give up because they have to be until they heal. They have to be cut off from their routine completely.
But Sharvin,
Until they heal, I will not say.
no, I'm saying
not sure
during the rehab period you're talking.
Yeah, on the rehab period. Until the acute phase of that thing subsides. They consult doctors, and most of us, we tell them that okay, now you should not do it. Most of the doctors advise them to permanently stop that.
Right.
The reason being that if we tell them that okay, now start, we don't know till what extent they are
what extent they're gonna go.
How do it? It starts again, and then it comes on to us that you said I can do it, and it happened again.
Very true.
Right. So, and then again, if it's a recurrent episode, they again stop and they're out of the sport journey.
Absolutely.
So, how do you go about reintegration of this post an injury back to the fitness? Like,
So I'll be very brutally honest, completely honest. Back in the day, I was the same guy you're talking about. I did not take things serious. I kept on going. My rehab period, I would shorten it down to 50% of the time. Like let's say it's 15 days, I'll cut it down to 7 days. Why? Because I was hungry. I had that fire in me that no, I'm gonna train. I'm gonna do it. It does not matter. I need to get up. I will be okay. But then that prolonged thing. Eventually, I tore my left shoulder in 2016.
Okay.
So I had a subscapular tear second degree, which I suffered in 2016. I did a rehab, but at that time I was competitive. I was a super performance athlete. I still am. But at that time I had no patience. I was young, basically. I had no patience to do a rehab. I feel good. And back in my mind, I knew it's still hurting me. But then still I pushed. So if you see my left shoulder right now, this is the maximum mobility which is there because of the subscapular. And this is my right shoulder. So I'll show you the difference. There's a huge level of difference with the mobility because this does not move any far from this. I'll tell you the difference behind it. This one I tore in 2023. I tore the same muscle here. But I did a proper rehab for this because I was patient enough that I am older enough, I'm wise enough, I understand that I need to give it a rest. I need to recover, I need to take proper supplements. And that knowledge, I recovered, I basically recollected with that knowledge in these many years and I used it in the right way. And it helped me recover completely normal now. This shoulder still hurts because eventually with time the subscapular muscle completely tore off. So from a second grade tear to a complete tear now. So it is completely torn as of now as we speak. Now there's only one option, you being a doctor, no, I need to get it operated to fix it. Or again, I had a word with my shoulder specialist, he told me that if you can bear the pain and the mobility issue, do it, then you can sustain. But now I'm training very smartly and I'm preventing injuries. The basic injuries are shoulders, back, and biceps is what you told me that you see a lot of patients which is odd.
So what we see is they don't injure their biceps. I would not say damage it. It's either because of the posture. They want to lift heavy.
Yeah, so
now can't do it.
They're just
from the back, the
back,
goes,
shoulders, they can go
and they finally complete that. And even with the same thing happens while going down, that because their arms cannot take that weight.
And they're stretching it further.
Further.
So I've been there again, stretching my bicep farther more. My bicep got pulled till my shoulder. Your bicep tendon got pulled till my shoulder.
So biceps tendinitis is what we get. We don't get tears. But more harmful is what the spine problem. Because of overlifting of the bicep.
So with the spinal issue, I think Sharvin, people go wrong again. The first topic we talked about is ego lifting.
Right.
Now, I'll show you the transition of myself. When I was competitive, I was lifting heavy. My goal was to lift in with. Right now, my goal is to stay fit, build a good body, maintain that physique. I go on a proper way, proper posture. I am not pushing myself over because I know that I am prone to having back issues. So I lift 70% of the weight I can. Like let's say I can deadlift 200 kilos. I'll be lifting 150 on a good day. doing more of reps with a proper posture, proper breathing technique. Breathing technique is one more part I would want to add where people go wrong. And that is why they have a lot of spasm issues, a lot of back injuries. I have myself gone through that again. That's why I'm telling you this. And the breathing practice is something that you need to do, which is not considered essential when you are training in the gym or lifting or playing any sport. But that is the first thing you need to be taught, that you should know how to breathe correctly when you're training to safeguard yourself.
When to inhale and when to exhale.
When to inhale, when to exhale, exactly. And that your trainer has to know and teach you.
Right. So proper guidance is one.
Proper guidance is one. Prevention of injury again. Proper posture that comes with the first day you start working out. People try to save money in any again coming down to those Google YouTube workouts. No dude. Chris Bumstead video or any athlete, Ronnie Coleman, anybody you see, they've been training since a long period of time. Their muscles are that strong. And they have got coaches behind them to guide them out of it. They are paying 50 times the money you are spending on your fitness.
Absolutely.
That is how they look like that.
No, and the second is the same, the posture thing that you said.
Yes.
The second problem is when they transition from a lower weight to a more amount of weight.
Yeah.
They are doing a lesser weight in a tight posture.
Exactly.
It's not going to injure them. So they think, okay, I can do this, I'll increase the weight.
Exactly. That's
After a certain point of time,
it's going to click 1 5 minutes and you
so at one point of time, it just injures the back.
it injures you
Because the first posture was not correct in the first place, and that kept on repeating.
So that's where the smartness comes in play. If you're trying to work your ass off every single week, like you have a deadlift day or a back day or maybe a spare lifting day, you keep it. You injure yourself and then you're off to bed for 15 days, 20 days.
Right.
So rather than progressing, you're going down.
Yeah.
Now coming back to the same part about how to get up from an injury, how to do a rehab, have the mindset. When I tore my shoulder back in the day, I was still training. I was avoiding moving this arm. I was doing my mobility training with this as per the physiotherapist and as per my doctor suggested me. That what to do. Basic stretches, basic internal, external rotations to strengthen the shoulder because that is the muscle I tore. With the whole body, I was training legs, I was training core, I was training the other body part, the whole left hand side of my body. I was training that during that period. I've got a video maybe that can be put up in that and you can see that how it's good. But it was the mindset that I'm basically talking about.
Right.
I have seen a lot of people कि सर इंजरी है तो अभी बंद वर्कआउट डाइट वाइट बंद. Now tell me how does your diet relate to it? There is no correlation. No? Like okay, you're injured, so you have a license to eat pizza. No, go have fun. No.
True.
About mindset, I always have. When I suffer an injury, might be, and I've always suffered bigger injuries, not small ones. That in that 15-20 day period, I know my body is on rest, or I'm not going to be able to give my 100%. Then let me give my 100% with my diet. So I stay in this shape and I don't fall down to get up again. So when I start, I maintain this body, I maintain this body fat, and then when I start training, I can go a step ahead rather than falling down on the ground, coming back again. Right. So that is waste of time. So that is where you need to be smart and apt, and you need to be very strong mentally to sustain that injury, stay there on your diet plan, eat better things for your recovery, and go ahead with your progress.
Right.
So that is the key element.
Exactly. So when you're injured, it is not the end of it.
Absolutely not. It's the start of the game.
Gradual integration into sport. Do all your things supervised under the supervision of a professional, so you don't fatigue yourself.
Absolutely.
And take care of the nutrition while you are while you're on rest.
And even your supplements. Yeah, so the supplement tip that I wanted to give prior to this discussion, which is going to help you for life. So I've got certain supplements that I suggest everybody for a betterment of life is ashwagandha, which is getting bigger in the market now, which has been in India. The source is India. I would
Yeah, it is getting in the bigger market outside India now.
Outside India now, people are craving for ashwagandha.
It's our thing.
It is our thing. We always had it right in front of us. We never used it, or we never believed in it. You know, it can be good also because we are more attracted to the Western people. You know, this is all about those traps. Exactly. So it is one of the best test booster. Females can also take it. It helps you maintain, deal with your stress. It helps you maintain good testosterone levels. It gives you good energy. It's a beautiful supplement to take. Second is multivitamin that we all know. we cannot get enough minerals from food. Third is fish oil.
Okay.
I'm a big believer in fish oil because it helps you lubricate your joints. It helps you get good fats in your system, omegas, which is going to prevent injuries also again. Because if you see, you might have seen a lot of right out spinal injury. So why does that happen? Because they are low on healthy fats. They don't take enough healthy fats in their diet. You take ghee also. Ghee is also one source of omega 369 in a vegetarian diet. That's the only vegetarian source.
You take protein, that is one key essential supplement. And for people who are above 40, collagen is a big must. These are my basic supplements that I suggest everybody should use.